Hey guys, my name is Matt Yazurski. I am a dentist anesthesiologist in Nashville, Tennessee. I have a mobile practice that works all throughout the area of Middle Tennessee. No standalone practice, no brick and mortar building, just kind of work from home and then go out to about 50 or 60 different offices around the Middle Tennessee area, some more than others. It's been a really awesome experience. I've been out for about 5 years. Graduated from the Stony Brook program in, 2012, and it's been a really exciting time for my family and I here. Last year we brought on an associate to work with us, so practice has been slowly growing over that time, and we can thank Stony Brook for being able to make that happen, and Dr. Epstein and the program there for preparing myself and my family to be able to take this challenge on of starting a new practice. So at this point, one of the questions is do I teach? I don't teach formally in a dental school. Tennessee has two different dental schools. There's one in Memphis, which is the University of Tennessee, and then Meharry Medical College has a dental school as well. I have been a guest lecturer at both of those, and that's been a great opportunities to be able to kind of share our knowledge. Myself and my associate are the only two full-time practicing dentist anesthesiologists in the state, so there's a big learning curve for dentists in this area to kind of understand what kind of services we provide and how that can affect their practice. When the other way that I do teach is at guest lecturing at study clubs. I'd say almost once every month or two I get invited to lecture, give topics of sedation and anesthesia, latest either drugs or monitoring, or what's going on with the ADA and different rules and regulations within the state. So I get asked to do that for pediatric groups, periodontal groups that have their private study clubs in the area. So that's been a real benefit, and the knowledge that I learned at Stony Brook has really helped me out in being able to feel confident being an expert in the field of sedation and anesthesia. As far as Stony Brook and preparing me for private practice, I couldn't have asked for a better experience there. It was very difficult. It's a hard program. It's a hard program wherever you go, but Stony Brook is a challenge, and I mean that in a good way. You get to do difficult cases. You get to do hard things. You're busy, but you learn a lot during that process, and it was really, really beneficial for me to be prepared and ready to go out and take on challenges of starting a practice. Learned a lot from the attendings at Stony Brook. You'll see that each one has a different way of practicing, whether it's mobile or in a standalone practice, or how you treat patients in the dental office. You can, I didn't do a carbon copy of anyone there, but I took bits and pieces from each of the attendings and said these things would really work well for the style of practice that I wanted to be able to have. And so you have the opportunity to learn a lot from each different provider that you get to work with at Stony Brook. We got to do a lot of off-service training, whether it was in the PACU or the pre-operative services that we had with some attendings there to be able to evaluate patients beforehand. That helps you learn a lot, because that's all on you. When you're out in private practice, you're the one who's making those decisions on what information you need about patients, what you don't need, and what's going to be vital to making sure that you keep patient safety your number one priority. So learning that stuff as far as what happens before you see a patient and put them to sleep, the different techniques on how to be able to put someone to sleep and wake them up and do it safely and efficiently. And then, you even get the outstanding opportunity of a post anesthesia, like a PACU rotation there. That's outstanding. That was one of the hardest challenges of being able to manage a large number of patients, many of them with serious issues or mild complications, and working with a team of nurses. That prepares you for going out and either working in a hospital or working with your team and staff in a private practice. And helps you be prepared to know what can happen after anesthesia and take everything very seriously. You know, you get to see a lot of sick patients there. It helped me realize that that when I'm dealing with patients here that are healthy, that medical issues, emergency issues that could come up don't have to be such a big deal because we're so well prepared from our Stony Brook residency. We get asked sometimes if we've ever had any serious anesthesia emergencies in the offices. Dentists ask us that. Patients ask us that. And I can honestly say, knock on wood, in over 5 years that I've been out, I haven't had any serious emergencies. We had no need to transport a patient to the hospital or anything like that. But I will say that we have had issues that if I didn't have the training that I had at Stony Brook, could have turned into major emergencies, whether it's a laryngospasm in the office where a patient desaturates and you give succinylcholine, to managing the airway of an obese patient, to managing difficult intubations. The knowledge that you gain at Stony Brook allows you to feel confident, to not panic, to be calm during those situations that in other providers' hands may not go so well. So no, I haven't had any major emergencies or any issues in the office, but I have been able to treat mild complications in a confident way, and that's all thanks to what I learned at Stony Brook. I do work with a colleague who trained at a different residency than Stony Brook, and although she's outstanding with the anesthesia that she provides, the level of confidence coming out, the freedom that you have in your last year at Stony Brook of being able to experience the feeling of working on your own without ever actually being alone is beneficial, because you need to have that preparedness. And not everyone gets. I don't think everyone gets that ability to work almost as independently as we got to at the end of our residency, because you know that the next day, once that residency is over, you really are out working on your own, and the buck stops with you. And so Stony Brook helped give that confidence of being able to go out and into private practice and treat your patients the way that you know that they would want to be treated. So if you ever have any questions, if people ever have any questions, you can get my contact information from Dr. Epstein or anyone there at Stony Brook. Feel free to reach out to us in Nashville, and you're always welcome to come down, spend some time with us down south. Thanks a lot. Hope you guys enjoy your time at Stony Brook.